I would just say that, these things are coming down the line, and I think that we have a chance, and there are other groups of breast cancer patients that immunotherapy is not yet approved in, but might be in the future. Those are things like high-risk ER-positive breast cancer, so there's an upcoming SWOG trial in its final stages of preparation called SWOG 2206 that will look at high-risk ER-positive breast cancer patients, which is actually a pretty large subgroup of our early-stage breast cancer patients. And since immunotherapy is not approved there yet, and because the clinical trials are being done through cooperative groups, so not directly via industry, I think that there's a lot of opportunity to explore from the ground up biomarkers there that can become companion diagnostics, that can identify the patients up front before we have the problem of approval in all of a subgroup of patients where only a minority benefit. Some of the ones that we're interested in are things like antigen presentation, as I mentioned. MHC2 is something that I've been working on. We've shown works in melanoma. Other investigators have shown this in melanoma and other diseases as well. And so some of these might be promising biomarkers if they're worked up and put into a really technically valid and clinically valid assay, but they need to be put into the clinical trials.